Hello you guys, my name's Dana, Dr. Dana Brems, and today I wanted to show you a quick what is in my bag. I was looking in my bag and realized that a lot of the stuff I have in it is really weird, unique, but that's just working in healthcare. So I just thought I'd share it with you guys today and just show you a little bit more of my life. I chose this purse because it's very compartmentalized. There's a lot of pockets, and then there's a zipper compartment in the center that just barely fits a laptop. It's just very convenient for organizing purposes. Here's the bag I would take to the hospital on a typical day. It's huge. For context, I'm a podiatry resident, which is foot and ankle surgery. So my typical day is a mix of surgery, rounding on inpatients, and seeing consults. So I might take this bag in and then take whatever I need from it throughout the day. But let me just start by showing you what's in it. First of all, I have this paperweight. No, I don't really use a stethoscope that much. It just stays in the locker for the most part, but I have it just in case. Speaking of lockers, the policy depends on the hospital you work at, but you usually change into the hospital scrubs in the locker room, especially if you work in the operating room. If you work in an operating room, then you have to wear the hospital scrubs because they're cleaned per the hospital policy. You cannot wear your own scrubs into an operating room. So the hospital scrubs look something like this. I mean, you guys have seen them, but they're very basic baggy scrubs. Depending on how lazy I feel, I'll wear my own more fitted scrubs like these in whatever my favorite colors are to the hospital, and then I will change into these scrubs before any surgeries. But if you wear the hospital scrubs the whole day, you return them at the end of the day, so you never have to do your own laundry. So something to consider. The next thing I'll talk about is my white coat. Here it is right here in all of its glory. I have 2 or 3 favorites by Metalita. They're pretty much known as having the best white coats. They're very high quality. They're not paying me to say that, unfortunately, but they just are. They're the best. I usually don't wear a white coat in the hospital. I just don't think it's necessary. I feel more comfortable just in scrubs. But sometimes if I'm in a more formal situation, if I'm giving a presentation, or if I'm in a clinic where the attending wears a white coat, then I will wear a white coat. But otherwise, I don't wear my white coats that much in the hospital. But, I have to have one around just in case. Something I'm sure a lot of you guys wouldn't expect that I keep on me or in my locker is these eye shields. Just these regular eye shields. Because ever since the pandemic happened, certain things keep going low and out of stock. So one of them is these eye shields. At least in my hospital OR. It's really hard to find these, and you need to wear eye protection while you're in the operating room, because you're operating, and then like a squirt of blood goes like bam, and it could go right into your eye if you're not wearing something. So it's bring your own eyewear in my town. And I only bring it up because just the other day I was wearing eyewear just like these, not this exact pair, and I was doing, surgery something, and then a squirt of blood, I just watched it and it hit right here. And it wasn't a big surgery, it was a tiny little thing, but it still managed to go right. It would have hit my eye if I wasn't wearing this, so moral of the story, better safe than sorry, and I keep a clean pair of these on me or in my locker. So moving on, of course, this might be expected, but I have my badge that I wear at all times. And I go to a few different hospitals, so I have my ID on each side. and I always wear it right here so it's easily visible so people know who I am and that I'm just not some stranger who wandered into the hospital with scrubs on. That's always a good thing. And then I have all of my keys, and on my keychain I always make sure to have at least one extra hair tie. Just for most people, for anyone with long hair, it's important to always have an extra hair tie because you never know when you need to put your hair up, but especially for people who work in healthcare, because you never know. You never know. And especially when you work in the operating room, you need to be able to put your hair up to put a surgical cap on. And then also, I always look past this, but this is how I keep my keys together. It's a foot. I'm a very big fan of the feet. And then also, I like to keep my AirPods, my headphones, on my keychain at all times. So anytime I need to stick in my headphones to listen to TikTok, then I am good to go. Kidding. I got tissues for when I'm crying. Kidding. These are the best. Not sponsored, but I wish I was. I have slightly oily skin, and whenever I start to sweat a lot, because Lord knows I will be sweating a lot during the day, you just dab your skin and it takes off like all that oil. I just put on makeup before this video, so I don't think it'll work, but I'll try. It looks like my forehead's a little bit shiny. I'll try that. So see how this is what it looks like before, and I'll try dabbing my forehead. I don't know if you can tell, but I'm slightly less shiny than before I dabbed myself. But anyway, that's why I keep these in my bag. Because I'm a lot shinier than this in the middle of the day. Along the same topic, I keep a tiny roll-on perfume in my bag. I don't know if you can see that. But it's a little roller ball. If I've ever been working a really long time and I want to put a tad bit of perfume on, I can just roll a tiny bit of perfume behind my ears, and then I'm good to go. And then I have some mints, bigger mints that I stole from the cafeteria. That mini concealer you can get for free from Sephora. And then I also keep some sort of hand sanitizer. And there's plenty in the hospital already, but you know, it's nice to have your own too. The trick is to keep a moisturizer too, so right after you sanitize your hand, make sure to moisturize it as well. Like anyone, my phone is pretty important to me, so I always keep a miniature power bank on me. I don't know why, but this particular power bank works super well, but it's just some random freebie power bank I got at a foot and ankle conference. And it just works so well that even ones that I've actually bought don't work as well as it. So I can't complain. And then in the same pocket, I also keep an adapter like this. And then, of course, I keep a bucket of pens. These pens are literally my favorite. They're all from the shoe company 𝐂𝐿, because 𝐂𝐿 sent me a bunch of shoes because of foot doctor. And these pens all say for borrowing only, and they're cute colors, so they're my favorite, and I have a ton of them. I love it. And then I keep a couple spare masks on me. I can wear these regular masks around the hospital, but I can't wear them into the operating room. You have to wear proper surgical masks or N95 masks into the operating room. Because you're right there with an open wound, and these are not good enough. And also, I always keep food on me. These are some bars by Life Extension. So they're like low sugar, high protein. This is important, but I always keep water on me, and I always have to have a very larger than average water bottle. to be happy. So I always make sure to go to the hospital with a full tank of water. Unlike a stethoscope, something that I actually always keep on me is trauma shears or bandage scissors, and I always clip them to my waistband with a badge reel and then put tape on it too. So I have a couple things all on me at once. And finally, I have this little beautiful bag. In this bag fits a little mini suture practice kit, and then all of the tools needed to practice suturing. So I got my pickups, my needle driver, a 15 blade for some reason, and multiple needle drivers for some reason, some suture scissors. Yeah, so I got all the stuff I need in here. And then, yeah, and then some spare suture. Before doctors or students put stitches in real people, they practice on something like this. So as you might know, we suture with this needle, and then the stitches are all of this thread that we cut piece by piece. It would be wasteful to use perfectly good suture material to practice on. So what students would do is ask the operating room for expired ones. As you can see, there's an expiration date. You can see at the tip of my needle driver there, so you can see this one's expired. I also have this teeny tiny flashlight. It's good for when you need to see the patient like early in the morning and you don't want to turn on all their lights to have to look at them, and you can just whoop, turn it on and then look. And not completely blind them at 6 a.m. And then this is the book where I keep a record of all the patients that I've done cases on. Basically, any patient that I've operated on, I take a sticker of their information, slap it in here, and say date of their surgery, what we did, and other notes. And I think this is like my third one. Whoop. Yeah, I can't open it up and show you because of HIPAA, but that's pretty much it. I emptied out my bag. It's just the center part has my laptop. My bag is empty. I have made a giant mess. I hope you guys enjoyed it. Please like and subscribe if you did, and I'll see you guys next time.